Hey everyone, Lee with Code 3 Medical Services, here today to go over something that's super easy, yet what we find when we train teams and rescue personnel, medical personnel, it's one of, even though it's easy, it doesn't get done properly more times than not. So again, practice, but we need to practice correctly. So let's go over tourniquets. What is a tourniquet used for? Tourniquet's going to be used to stop blood flow to an extremity that obviously has severe bleeding or hemorrhaging and direct pressure, and a pressure bandage will not be sufficient enough to stop that. So we go to a tourniquet. What are we doing with this tourniquet? Well, if we look at it, it's just a mechanism, a tool that is used to compress that vessel completely closed. So we stop the bleeding, nothing gets past where we apply this. Some things to think about when you look at tourniquets. The old days when I got certified 30 years ago, you were taught 2 inches above the injury site. Well, what we know now through battlefield trauma and multiple wars is vessels can actually retract 2 to 4 inches. If I estimate and that vessel retracts 4 inches, but I only put it at 2, I have done absolutely no good, okay? 2, what we look at, this is compressing that vessel. We need something rigid and with some substance to be able to compress that against. When you look at our lower leg and our lower arm, we have 2 bones there with a lot more muscle. There's not enough substance to compress that vessel to stop bleeding. Compare that to your humerus, which is a single, same as your femur, large bone. I've got a lot of mass that I can compress that vessel up against and shut the bleeding off. So nowadays, what we teach is high and tight. I need to go as high up on that arm as I possibly can, or high up into the femur as I possibly can, in order to compress that vessel against the largest part of the bone, okay? Then it rules out any possible errors of, well, am I 2 inches above or am I not enough? Take it out, take both of those issues out of the equation. High and tight, very simple, okay? Now that we understand the concept of what we're doing and why, we need to look at, there's 2 tourniquets out on the market. Really, there's 3 that we can recommend. The CAT tourniquet, which is the Velcro, the Soft T Wide, which is a metal buckle, no Velcro, a little different setup, and then the SWAT T, which is like a large rubber band that can be used as a tourniquet and also a pressure bandage. Now, the difference being the CAT and the Soft T Wide are pretty much the standard for medical professionals in the military. So that's what we're going to recognize and go with. When you get these, the CAT specifically, it comes in plastic and it's all bunched up and is a complete mess. Take it out of the plastic. You got to set yourself up for success. What we're looking to do is apply this tourniquet within 15 to 20 seconds. All right? And if I have to fiddle fart around for 10, 15 seconds under stress, trying to get plastic off, get this set up, I'm wasting time. So set yourself up for success. Take it out of the plastic. I open it up and take this tail out of the buckle. So it's just one piece. Rerun that tail through the buckle and run it up about 6 to 8 inches and fold it on itself. Now I've given myself, the tail is thicker. If I'm in the dark, I can feel where the end is that's going to allow me to just pull and take that slack out, whether it's in a dark environment or I'm under stress. Take this portion now that I doubled on itself, fold it onto the Velcro itself, and then fold the tail back over that. Now what I have is I can now pull this out of my bag, pull it out of whatever carrying device I carry a tourniquet on, if I'm law enforcement or military, open it up, and lo and behold, looky there. I now have a hole for that arm or leg to go through, and I can do that one-handed, okay? Key on this, like we talked about, comes up all the way. We want to remove all clothing, whether it's going onto a leg or an arm. This needs to be exposed. Cut it off, take it off. It needs to go directly on skin. From there, we're gonna bring this up. Take my tail that's nice and thick that I can feel, pull all of that slack out and wrap it around. At this point, if I've taken that slack out, Shouldn't take too many turns in order to stop the bleeding. Not a fan of giving individuals the number of turns. It could be 2, it could be 5. The key is we don't stop turning this clasp until the bleeding stops. Once it stops, I'm good. So I will turn, I'm gonna turn, lo and behold, the bleeding is stopped, lock it in. From this point, you're gonna take that tail, run it through the lock, take my white safety that has the time, put it over that. Now I can put the time that this application was applied. This is not going to go anywhere and come unloose, and it keeps the locking mechanism in place. It keeps this from flying out and losing the tension, and you may not see that under stress. Moving the patient around, gets hit or bumped, next thing you know we have bleeding. So at that point we can also check with our pulse and our cap refill to see am I getting perfusion down here. If I am, then I'm not doing my job, and more than likely I still have bleeding going on somewhere, which should be obvious to the naked eye. So key is turn this till the bleeding stops, lock it in, you're ready to go. High and tight, once this goes on, we do not take it off until you get to the hospital. There may be times where if I'm dealing with, say, a thigh, and this has to go on the leg, sometimes one of these may not be enough. So if need be, it's on a leg or the bleeding hasn't stopped, I may need to bring a second tourniquet, butt it up against the first, crank it down. Now I've got 2 working for me, that should do the job. Typically that's something you'll see when you're dealing with large thighs. That's a large area, and sometimes you just need 2 tourniquets in order to accomplish that goal, okay? So hopefully y'all learned a little something today. Practice, practice, practice. Set yourself up for success. Again, 15 to 20 seconds, do it right, and you're gonna have a better chance of survival with that patient if we're dealing with massive hemorrhaging. So, till next time, y'all stay tuned. We got more coming to you on tips and tricks just to simply help you out and be better at saving lives. And until next time, train hard, y'all be safe.